On June 28th, the Congressional Budget Office released a new estimate of how many people would lose health insurance under the Senate's version of the budget bill. They said if this version becomes law, 11.8 million more Americans will become uninsured. On top of that, an additional 5.1 million Americans will lose health insurance if those enhanced premium tax credits in the Affordable Care Act are not extended. Now, their estimates came in just before the Senate started to plan its vote-a-rama marathon on their version of the Senate bill. And the Senate is now sprinting ahead with their budget bill process after what was called a weekend of setbacks, and they still want to get a bill to the president's desk by the 4th of July. But voting on a series of amendments could take some time. And in fact, some Democrats have pledged to offer lots of amendments. They said they want to make the Republicans defend their billionaire tax cuts and try to explain the massive Medicaid cuts. The new analysis from the Congressional Budget Office found that in addition to knocking 11.8 million more Americans off their health insurance, the budget package would increase the deficit by nearly $3.3 trillion over the next 10 years. Senator Tillis, a Republican of North Carolina, said the bill is a betrayal of the president's promise not to kick people off of their health care. But some other Senate Republicans, like Rick Scott, Mike Lee, and Ron Johnson, are pushing for even steeper cuts. They even had Trump warning them not to go too crazy when cutting Medicaid. As it stands, the bill cuts Medicaid by about 18% and food share, SNAP, by about 20%. That's over $1 trillion in cuts to Medicaid alone, with the possibility of more cuts based on how Medicaid expansion is ultimately financed. It's being called the biggest rollback in federal support for health care ever, and the biggest cut to programs for low-income Americans ever. You can read more coming out of the Congressional Budget Office. We link to the report in the description below.